In Module 1, we built our foundation, we defined monitoring and evaluation, explored their differences, understood why M&E is essential, examined the logic model, and even discussed how to create smart objectives and select good indicators. Now we shift gears from the what and why into the how. Think of this module as your M&E toolbox. By the end, you not only understand the different tools but also when and how to use them effectively. 1. Conducting effective program monitoring. Monitoring is not simply a checklist exercise, it's a systematic process that should be embedded into your program's daily operations. Basic steps to effective monitoring. Define your indicators clearly, know exactly what you're measuring. Identify your data sources. This can be surveys, reports, administrative records, or direct observation. Create a monitoring schedule, determine how frequently data will be collected. Assign responsibilities, know who is responsible for each activity. Collect and verify data, ensure accuracy before analysis. Analyze and report, turn numbers into actionable insights. 2. Potential data sources for program monitoring. Here are 3 common sources you can rely on. Routine service data, e.g., patient records in a health clinic. Surveys, periodic collection of information from a sample or the entire population. Observation and site visits, seeing activities firsthand. Tip: triangulating, that is, using more than one source, increases the credibility of your findings. 3. Descriptive analysis for program monitoring. Once data is collected, the first step in analysis is descriptive statistics. This means summarizing data so it's easy to understand. Common measures include frequencies and percentages, e.g., 40% of participants completed the training. Means, averages, e.g., the average number of visits per patient is 3 per month. Ranges, e.g., the shortest wait time was 5 minutes, the longest was 90 minutes. Descriptive analysis helps you quickly spot patterns, outliers, and possible data quality issues. 4. Data visualization methods. Data visualization turns your findings into visual stories. 3 common methods are bar charts, great for comparing categories. Line graphs, ideal for showing trends over time. Maps, powerful for illustrating geographic distribution. A golden rule in visualization: simplify. If your audience has to squint or decode your chart, you've lost the message. 5. Quantitative data collection methods. Quantitative data deals with numbers, measurable quantities. Common methods include structured surveys, using standardized questions. Survey statistics, existing records and reports. Structured observations, counting or timing activities. 6. Quantitative sampling approaches. Sampling is about selecting a subset of a population to represent the whole. 2 major types. Probability sampling, every individual has a known chance of selection. Examples: simple random, stratified, cluster. Non-probability sampling, selection is based on convenience or judgment. Examples: purposive, quota, snowball. To calculate sample size, you typically need expected prevalence or proportion, desired level of precision, confidence level, estimated response rate. 7. Principles of data collection. 3 principles to guide all data collection. Accuracy, data should be correct and precise. Consistency, data collection procedures should be uniform across sites and over time. Timeliness, data should be collected when it's still relevant. 8. Qualitative data and how it differs from quantitative. Qualitative data focuses on descriptions and experiences rather than numbers. It answers how and why questions, giving depth to the numeric trends you see in quantitative data. 9. Advantages and disadvantages of qualitative data. Advantages: provides rich, detailed understanding. Captures unexpected information. Gives voice to participants. Disadvantages: time-consuming. More difficult to analyze systematically. Findings may not be generalizable. 10. Qualitative data collection methods. 3 common methods. In-depth interviews, one-on-one conversations for detailed insights. Focus group discussions, group interactions to explore perceptions. Participant observation, immersing in the setting to understand behavior. 11. Planning a qualitative evaluation. Steps include: define your evaluation questions. Choose appropriate methods. Select your sample. Develop your data collection tools. Train your team. Pilot test your tools. Collect, transcribe, and analyze data. 12. Commonly used qualitative sampling methods. 7 methods include: purposive sampling, selecting participants for specific characteristics. Convenience sampling, those easiest to reach. Snowball sampling, existing participants recruit others. Quota sampling, ensuring specific subgroups are represented. Theoretical sampling, driven by concepts emerging during research. Maximum variation sampling, capturing a wide range of perspectives. Homogeneous sampling, focusing on participants with similar traits. 13. Determining sample size for qualitative data. Unlike quantitative sampling, qualitative sample size is often determined by data saturation, the point at which no new themes emerge. 14. Minimizing participant vulnerability. Evaluators must adopt procedures to protect confidentiality, avoid psychological distress, ensure voluntary participation, provide support or referrals if needed. 15. Ethical data management in M&E. 4 categories of safeguards. Confidentiality safeguards, store data securely, anonymize responses. Informed consent, ensure participants understand the purpose, risks, and benefits. Data integrity safeguards, prevent unauthorized modification or destruction of data. Responsible sharing, share findings without exposing sensitive information. Closing tone, summarizing and motivational. And that brings us to the end of Module 2. We've now gone from defining M&E to equipping you with the practical tools for collecting, analyzing, and ethically handling data. When you combine the clarity of Module 1 with the methods in Module 2, you have a complete roadmap for designing, implementing, and assessing programs in a way that is rigorous, credible, and impactful. Remember, data is only powerful when it's used. The true value of M&E lies not in the reports you produce but in the decisions those reports inform.